Welcome to Alzheimer's Speaks Radio. I'm your host, Laurie Gredlein, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about the mental change. We will.
Hi, everyone, and welcome back to Alzheimer's Speaks Radio. I'm your host, Laurie Gredlein, and I'm thrilled you can join us. If you liked our opening music, it's called Clarion Call by the Mark Arneson Band, and you can pick that up on any of your favorite music platforms. For those of you that are new, Alzheimer's Speaks is about sound information, not just sound bites. We want to talk to real people in the trenches making a difference, and that's exactly what we're going to do today by giving dignity back to people who are dealing with incontinence. And before I introduce our guests, I always like to do some shout outs. So here it comes. Check out Dementia Map. If you haven't done that so far, it is an absolutely fantastic website we've developed where you can find products, services, and tools from all around the world. No need to sign up, give any personal information, just go there and browse, dementiamap.com. And I also wanted to mention that on April 7th and also on Friday the 8th, I will be down in Winona, Minnesota, and we're going to be doing a screening of the film A Timeless Love. So please come and check that out. It's free. You can register by calling 507-454-5212. And then on April 20th, Artist Senior Living is sponsoring a program I'm going to do virtually, which also is free, called As the Cookie Crumbles. And that'll start at 5:30 Central Time. And you can register for that by calling 312-427-1514. And our friends in Central Minnesota, the Dementia Community Action Network, is having a dementia summit that is also free. And the keynote speaker is going to be Dr. Dale Brennison, and the moderator will be Dr. Patrick Zook. So check that out on May 12th. You can email me on, if you want more information, or check them out on Dementia Map as well. Let's see. I always like to mention a couple of programs that I do for support. So Arthur Senior Care is continuing to sponsor Arthur's Memory Cafe. We have gone online, and we meet the second and the fourth Wednesday of each month, and everyone is welcome to join us there. And then also Brookdale North Oaks sponsors a Caregiver Connect program. We're hoping to go back to being live again for that. Again, reach out to me at radio@alzheimersspeaks.com for more information. And then Maud's Awards, of course, is open right now to applications. So if you're an individual, you could win up to $5,000, an organization up to $25,000. And this is for work that you've already done. So check out maudsawards.org. Let's see. We are going to hear from the Adaptive Equipment and Caregiving Corner. They're going to talk a little bit about the Footbar Walker, and we will be right back.
I love the Footbar Walker, and let me tell you why. It is the option for my toolbox that I've been waiting for. Let's be honest, there are some clients who, despite our best rehab efforts, just aren't able to return to performing a sit-to-stand transfer on their own. Now I can offer my caregivers an easier, safer option that doesn't involve hoisting their loved one up from a sitting position. I don't recommend this walker for all of my clients, but I do recommend this walker for those caregivers looking for an easier, safer option with transfers. I would also encourage other therapists to add this walker to their toolbox. It's kind of like having my own mobile parallel bars for the client to pull up on. Whether it's a family caregiver at home helping a loved one with Parkinson's or dementia, CNAs in a long-term care facility assisting their patients, or therapists adapting to client and caregiver specific needs, we now have a very safe and effective option to offer in the Footbar Walker. Check this product out at thefootbarwalker.com. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.
Okay, it is time to introduce our guest today. So again, we are going to be talking with Seni and Platinum Home Care on a new incontinence program that preserves dignity, not only for the person with incontinence, but those caring for them. First, I want to introduce you to Deanna Vigliotta. She is the National Sales Manager for Seni, and they are known for premium adult incontinence product. She has an extensive 30-year background in healthcare, in sales management, and she joined the team whose parent company is TZMO in early 19 to expand their brand here in the US. And they're doing that through education awareness for both consumers and those that serve people dealing with incontinence, such as home care and senior communities. Now, joining Deanna is Laurie Gredlein, and she has been working in healthcare and senior living for over 15 years herself. She is the account manager for Seni in the Northeast region. And then last but not least, joining us is Jill Lennox, and she is the outreach director for Platinum Home Care, which is a woman-owned and operated independent home care company based out of Monroe, New Jersey. And it covers 7 different counties. Jill specializes in client relationships and serves as a resource for families in need of home care. So, ladies, I'm thrilled to have you all with us. I think this is such an important topic. Incontinence is so intimidating and has so much stigma, and people are so vulnerable. And so I have to, again, really, really thank you for doing such a nice job about educating people and coming up with a program to battle all of this and really bring back comfort to people. Now, before I go into our line of questions, I always like to ask everybody, and I know Deanna and Laurie, you've answered this on the other couple shows, but everybody listens at different times. So Deanna, I'm going to throw the question to you first, and that is, have you been personally touched by dementia in your own family or circle of friends?
I have, Laurie. My father's side, my aunt on my father's side had Alzheimer's disease and unfortunately passed from it.
Okay. And Laurie, how about you?
Yes. So my grandmother had it and she was declining. So she ended up moving in with my father, and they were the caretakers for her for about 5 to 6 years before she passed.
Okay. And Jill, how about you? Have you been touched in your own family or circle of friends?
Yes, unfortunately, we have as well. My husband's mother, before she passed, they were living in Florida. And unbeknownst to all of us living out of state, not knowing how things progressed until she was hospitalized. And then it was definitely an eye-opening experience that forgetfulness had totally transformed into something that no one really knew. But yeah, we've been touched with it as well.
Okay, thank you. Well, Deanna, I'm going to start with you, and I'm going to ask you if you can just kind of recap, the overall value and benefits for people regarding Seni products. We've done 2 shows. If you haven't listened to those, feel free to go back and listen to those. This is actually our 3rd part of a 4-part series. And then also, if you can include, I think it's really important for people to know the why behind the importance of getting home care agencies offering your Continence Care Program to their clients.
Sure. Well, thank you, Laurie. I continue to be grateful to have the opportunity to share more information about Seni products. So for those that haven't been able to tune in the last few weeks, Seni is a premium brand of adult incontinence products. So we have a full line of adult pull-ups, adult briefs, skincare, washcloths, underpads, all types of products to help people have better outcomes and live a more improved quality of life. But what we offer is far beyond just products. And to your point, it's the why behind our products. We are trying to shift culture in America to help people better understand that products can make a difference for people. So instead of thinking as incontinence products as same old, a disposable commodity, if you will. We're trying to help people think of them as a vital, critical component to the continuum of care when people and if people become incontinent. The why behind it ties to the many wonderful features of our products. For example, they're fully breathable. So rather than just sharing with folks, well, our products are fully breathable. Well, what does that mean? Well, what that means is your skin shouldn't break down if you're incontinent. You shouldn't see redness. You shouldn't get skin breakdowns. And that has a wonderful positive ripple effect out for everybody involved. If you're a adult child of a mom or a dad who is at home and they've got skin breakdowns, now you've got worry and now you're looking for answers. So it just ripples and ripples. So they're fully breathable, big, that's a big deal. That's a good deal. They're super absorbent. The way that they're constructed, they have polymers and cellulose pulp, which when somebody voids in a product, that urine is being wicked away quickly away from a person's private parts. It's being locked in place. That reduces odor, but it also helps reduce UTIs, reduces leaks, reduces all the ickiness that can come with incontinence. So they're fully breathable. They're super absorbent. We have inner leak guards in our products. That's a huge deal because we hear more and more and more, unfortunately, people that are living at home, people that are in communities. People are changing sheets. Folks are waking up at night. If they wake up at night, they might be groggy. Why did they wake up? Well, they're either soiled or maybe they just had a trickle, but they're uncomfortable. Now they're wet. They get up, they fall, then they end up at the ER due to a fall. So these inner leak guards combined with the other features help people sleep uninterrupted through the night. What does that mean? Well, then we get down a path of good restorative sleep, which means they wake up the next morning more alert, more engaged. If I'm aging in place at home and I have a caregiver that's coming in to help me, I'm probably going to be a little more happier if I've had a good night's sleep. And that caregiver is probably going to be a little more happier to be helping me if I'm in a better mood. So it just goes on and on. And then the products, I think, is really a really nice feature. They're made of what they call soft non-wovens, but in layman's terms, if you think of soft materials that are comfortable to wear, and they also don't have a noise that goes along with them. So people that may be incontinent want to go out in public and enjoy their families and go out to lunch and do all things that everybody wants to do. They don't have to have that worry of, oh, can I be heard? Oh, am I going to have an issue? So our mission is to improve the quality of life. It's a simple thing, but it's a complex thing. And the program, a Continence Care Program, is what we are hoping that more and more and more home care agencies offer to their clients. And if they offer it to their clients, we're hoping more and more clients see the value in joining a program. But basically, we are manufacturers. Seni does not sell direct to consumers, but through our relationships with home care companies now, they can offer Seni products, starting with samples so people can try before they buy. And then if a client says, I like this is working, how do I get it? Well, now they can get that product through companies like Platinum, who are in the homes and helping clients in their homes. So it's a program that we put together pre-pandemic that has just evolved to a wonderful point in time. And together with so many partners, we hope our mission continues to be, let's change the way we think of things. And my goodness, if we can do that, it will not take a lot of time to see better outcomes. That's really the kind of neat thing with incontinence products. A change in product and good things can happen very, very quickly. So that's a little bit background on the products and what we're trying to accomplish.
Wonderful. So it really is kind of change the product, change the number of times you have to change, because of the absorbent material and stuff you have, and then you're changing the whole belief system through that. It's just a really nice trickle down effect. Now, Laurie, I have a question for you. You know, the last couple of weeks we've been talking with larger franchise owners, and this week we're going to be talking with Platinum Home Care. So how do you work with both large and independent agencies? Is there a big difference between that with your Continence Care Program?
Only from the standpoint, making sure that, I try to get as many meetings set up with each chain office that's in my territory. So with Platinum, it's kind of nice because it's a one and done shop. So it's a one owner and one location in New Jersey. Thankfully, Jill covers a lot of the state because I cover the entire state. So with Platinum, it keeps things a little bit easier for me. Jill and I do some co-marketing together. We have sponsored events together. Things like that really are nice to do with your partners in this industry. And she's the front line to those families. So it's wonderful because she hands out our samples, especially once she starts talking to the families and learning that their loved one might be challenged with some incontinence, or let's say they're doubling up on their current product, things like that. Jill says, hey, listen, we've partnered with this company called Seni, and here's some product samples that you can try them out and let me know your feedback. So it's wonderful to have that one partner to work with as opposed to many different offices. It keeps it a little bit easier.
I like that you work with both, because everybody needs to know about your product. I mean, that's truly my belief.
Sure.
I think this is just such a life-changing product that you have, and big and small companies and families. I mean, this just impacts so much in terms of quality of life. And Deanna, even when you were talking about, reducing those issues with skin irritations. I mean, I don't think, most people don't know what a bed sore is till a bed sore hits somebody they love. And then it's like, oh my gosh, this can be really, really serious. What do you mean they could get a major infection from this big stuff, from personal dignity to freedom. And I think building relationships too, just changing that mood in terms of coming into not a crisis situation, but one where everyone feels a little bit more comfortable. Jill, why don't you tell us a little bit more about Platinum Home Care and your role with the company?
Sure. Platinum is located in Monroe, New Jersey. I am hired to be their outreach director. I also cover about seven different territories within the state, which is how I met a lot of my industry partners, including Laurie. Platinum is women owned and women operated, so we're pretty proud of that. We definitely take the time, not unusual in the industry. You have to be very compassionate when dealing with all types of families in different crises. Our main patient is one that's either leaving the hospital or has left the hospital and gone to a rehab, and now their wish is to go home. So whether it be from a surgery, from a fall, from dementia, something has caused them to go to the hospital, and something has caused them now to want to leave the hospital or the rehab center and get home. So that's our job. And as the outreach director, I am that go-between between the social workers and facilities, or a family member and that family person needing to get home. So I listen to all of everyone's out there, the social workers, the facilities, the families, and also the client or patient, to figure out what their care plan will look like, how many partners I'll need to bring in, talking to them about all facets of home care. And Seni is that one as well, for keeping their bedding dry if they have a hospital bed, if they need incontinence products, informing the family and trying to give that education, because maybe they went into the hospital, their loved one was okay, walking, ambulating, toileting fine, but now since something has happened, they're no longer in that same position. And a lot of times family members don't know what to do, whether that be with ambulating and getting to the bathroom, all the facets of total home care. That's what we talk to the families about. We provide. If we can't staff the position ourselves, I work with everyone in the industry, hospice, other facilities, long-term care, memory care, and skilled nursing facilities as well to make us that one last phone call. The family will never have to reach out to anybody else, even if I can't staff it. I'll reach out to our industry partners for them on their behalf, and we'll make sure that they get home safely.
Wow, that's a huge benefit, because I can tell you so many families are spinning going, and now I'm supposed to do this, and I don't even know what questions to ask, or they're telling me they're full, and they gave me 3 references, but these aren't going to work. Where do I go? And to be able to have someone to rely on that
Exactly.
knows the ins and outs and knows the partners that can support them, that's a huge, huge benefit to families. Massive, because I see them when they're ready to rip their hair out, and they're just bawling, sometimes can barely talk, going, they're just so overwhelmed with everything. So having that package together is really nice. Laurie, I'm curious in terms of, I know Jill said you guys had kind of met through networking, but what different types of groups do you participate in? And is there a tale to be had in terms of you and Jill and how you met?
So I remember, Jill, I don't know if you remember this. I remember meeting Jill at one of her competitors actually had an event, and it was kind of in the middle of COVID. So we were outside for this particular event. It was last summer, I believe. And Jill was just so friendly and had a smile on her face and said that she was new with her company, and I was kind of new to New Jersey, and so we clicked pretty quickly, and we talked about doing some co-sponsoring in the future for some events, and we hit it off because we were both entering new territory, if you will. And then we immediately became fast friends. Jill assisted in getting me into her office with her director of nursing, her owner, to do a demonstration, which we love to do. Seeing is believing when it comes to Seni. So I did an in-service and a demo for their team. They just were completely wowed by our products. And since then, the reps, including Jill, are now, like I said, talking to the families if they're having issue with incontinence, and sometimes even if they're not, right, Jill? I mean, she's still happy to pass out some Seni samples to say, hey, give this a try. They're a little newer to the US, but I'm telling you, this is worth a look. So,
well, and all of my packs now at the start of service include all of my Seni samples, whether it be a bed protector, body cream, barrier cream, which is so important to preventing infection and skin breakdown. I put in a brief, I put in a pull-up style, a tab style, just a few different types, because a lot of times the families don't know what's going on. They don't know what mom or dad is going to need, or their spouse, even what was happening in the rehab. I didn't know they needed something. So in my first, initial go bag, I'm putting all of these, and especially the washcloths, because sometimes they might not need it. They can ambulate to the shower, but they might be just tired and overwhelmed with getting home. And just to be freshened up with a wipe and a wash in a waterless environment, they're not ruining their bedding. They're not getting everything soaked. And if they're just tired, but they just want to feel fresh, it makes everyone and the patient feel so much better to have those products. So now that's a go bag with every start I have. And it's working tremendously to get the Seni exposure out there.
Well, and I like that you're doing that because, like you said, people don't know what they don't know. And, for most of us, for family, I mean, we go to the drugstore and we see product and we look at it and kind of, drop our jaw and going, I don't know what I need here, and to see all these different variables that can be used. And, even if you're introducing them before they're needed, again, knowledge is power, to people, and word is spread, and they might end up having a friend who needs something, and they'll be the first ones to say, I didn't even know this existed, but we got this, and maybe you need to talk with them about getting this lined up. Really important. What kind of challenges do you hear and see about urinary incontinence from your teammates, from your professional care providers?
My aides are on top of every client. They're reporting back to the office about what they're seeing, how that person is. Our director of nursing goes out to every start and then follows up, 60 days, 30 days, ongoing services. And the first thing that they always look for is hydration with the skin, checking it, make sure it's healthy, but also making sure that there's no skin breakdown. And we talk about, like you said, bed sores, redness, rash, anything that could be an irritant, because we all know a UTI will send that person right back to the hospital. And then you just get on a hamster wheel that just is a never-ending cycle. So if we can keep that person healthy and safe at home, and that includes skin safety, that includes free of infection, that includes free of bed sores, by using the barrier cream, by using the Seni either briefs or pull-ups, they stay dry, they're breathable, they don't leak. So our caregivers are loving the fact that we can now have a product that we bring samples to the house, to educate the family, because again, the person is getting discharged, they don't know what they need. So to have at least something on hand and the ability to have one phone call and ask, oh my gosh, we need this. I can either order it for them through, a line item on our invoice, and I'm happy to partner with getting that service to them, or they can call the partner directly and they will even deliver it if it's close by. So we are immediate, happy to jump on it, cause of making sure that, yes, one phone call will get you whatever you need as quick as possible. We believe in the product and it speaks for itself. My clients, their skin is healthy. They're not getting breakdown. Again, I know you talked to the quietness of it, but that's also dignity. They're coming home and they maybe never needed to use a product before, but now they have to. And that's their pride. And we have to restore that, as well as restore their body to their before injury or before hospitalization. And that's the whole person, not just what part caused them to go into the hospital.
Yeah, exactly. You had mentioned urinary tract infections, and they're referred to as bladder infections, UTIs, for some of our listeners out there that might not know. They're kind of all blended into one thing. But one of the things that I have heard, and I'd be interested to hear from you, Jill, that a lot of times once you get a UTI or a bladder infection, you're more likely to get them again. And many times, I've heard this from doctors as well, that they should always be rechecked to make sure the infection's gone after the medication. And I've had friends personally who have had to deal with this, where they've taken their medication, and then it's like 3 days later, all of a sudden it hits, and it hits even stronger. And they actually needed a second dose to cut through the chase. And I would imagine that's something that you guys can be all over with and preventative with as well on that.
Definitely. Our aides are certified home health aides. For the most part, we also offer companion care, which is either hourly, and we provide hourly and overnight service as well, live-in. We are not skilled nursing, but if our aides were talking or communicating or noticing something during changing or showering, or even just verbally communicating that the client was uncomfortable, they would relay that immediately to our director of nursing. And then she would be right on top of it, whether we would help the family call for a visiting physician to come out, or they were going to be, if they're ambulatory, they could schedule a teledoc or get to the actual physician for a test and recheck. So we would be happy to partner with them at any concern, getting right on top of it before it escalates and then they need a hospital stay.
Okay. Have you gotten feedback from family members regarding the product and how it's changed things?
And clients.
The family.
And clients directly. I have clients who are independently living by themselves with help from our live-in aides, and they love it. They call me all the time. Can I please have, the number? I'll order for you. No worries. We'll take care of it. We'll get it shipped. Or I get them and I bring them there myself. But it's a big peace of mind to get something, A, that fits correctly, and B, that they know that there's not going to have any leaks overnight. They're longer, they're higher, they have that double leak guard inside. So for them, it's peace of mind that their aide isn't going to come in the morning, and I think you've touched on it, they're going to sleep better because they're not going to be uncomfortable. They're not laying there going, oh my gosh, I'm waiting for my aide to come to change me and I'm really uncomfortable. So if they are bedbound, we have to be very careful and cautious with their skin, with their body, and with their changing. But by helping them have a product that fits, that is absorbent, and with the overnight abilities to keep them healthy, they're waking up happier, more refreshed. But yes, I have clients that live independently who do reach out, and we do place the orders for them. So they're able
Okay.
to speak for themselves, and they are very happy.
Wonderful. That's great to hear. And that's been a consistent message through this series, which is really nice too. Deanna, we talked about the adoption of the Continence Care Program, nationwide, by home care agencies. We did that a little bit last time, but can you speak to that again? Because I think it's just such an important concept. And, what's the vision for the program? If somebody's listening, can they rat tat tat on your door, shoot you an email, or call you and go, hey, what about us? What about us?
Well, we would love it if more and more home care agencies knocked on our door for sure. It's interesting. I think we'll all agree that the demographic of people in our country with Alzheimer's, for example, is growing, and the statistics are staggering. So as people age longer, whether it's at home, whether it's in a community, in a way, with home care agencies, for example, there's so many people in need of help that it doesn't become, I go to a lot of networking groups as well as Laurie and my other teammates. There's not this competitiveness of, there's only so many clients and I need this one. There's not enough people out there to help others. We need more and more and more help out there, more people. So certainly in a perfect world, what we do envision and what we're seeing between national chains and then independent home care companies, as we have evolved this program and as we're able to convey better messaging, I look at where we started of, wait a minute, this is a new program. How do we tell people this, that, what are we've gotten much better. Said, okay, light bulbs have all gone off. There's huge benefit for home care agencies to offer a program. Now, how about those clients? Why would I join such a program? We're able to share the reasons why someone should consider joining a program. So whether it is a large national chain, we work with them. We've had a couple on prior. Independent, we work with them. We will work with anybody who has clients that are incontinent that need help. I mean, that's kind of our primary focus. And I think most people in home care, in senior living in general, and healthcare in general, I think it starts with let's help. If we all help people, that to me is the basis of humanity, right? So we envision this. It is gaining traction. It's very exciting because of those outcomes. And you mentioned it, Laurie, the consistent messaging. That's very rewarding, and it's rewarding to hear, but more importantly, how rewarding for that family that's seeing the difference, and their extended loved ones that are seeing the difference. That, in our opinion, is what it should be all about and what it's all about. So our vision is that this home care agency offering of a continence care program will continue to gain traction. More home companies will say, well, tell me more. Yeah, you piqued my interest. What's it all about? Why would I offer that? Why could I? How should I? And we have so many tools and resources to be able to help guide folks that are interested to make it easy. I had touched on it last week, I think, but one of the things when we are even approaching a new agency is we hear quite often, we don't do that. The clients provide their own. And we will say, no, we know that has been in the past, home care agencies have said, so what you don't know, you don't know. And you say, yeah, we have, and we'll say, no, we know, but this is new and different. And breathe. We're not here to sell you anything. We're here to give you the tools, give you the resources when you have a client, and you will, when you have a client that your caregiver, the light bulb goes off, or you yourself, agency owner, are out there, or you yourself, director of nursing that's out there, whoever's out, that light bulb goes off is, I've got soiled sheets, soiled garments. I've got a UTI. I've had a fall. I've got the light bulb goes off. And all we're saying, and exactly what Jill mentioned, is just try a product. We'll help you with measuring. We'll help you with the fit. We'll help you with all those things, because we are deep in the weeds of eat, sleep, and breathe it every day. We're the experts in it, and in a good way. It would be odd if we weren't. So I don't mean that. I mean that from a very humbling purpose, but we can help. And so when you put that combination together, being able to guide agencies, being able to help nationwide, again, the adoption of it, to me, the impact of hospital admissions would be significantly decreased, and that would lead to readmissions being decreased, less fixes, right? We're very much a country that is reactive, and we have all these great resources to fix. Well, how about we get a little more proactive and say, let's not get to the ugly here. Let's start with good quality products, breathable products, good wipes, good creams, and be proactive and focus on the individual. A person-centered approach to care is a big deal too. So those components is how we see, and when we see it, I'm sure all of you on the call today see it. We see more and more articles, the importance of focusing care overall on the individual, on the continence care part. The individual is very important. So person-centered approach to care. We hope that continues with the adoption Continence Care Program going through home care agencies. Because if you think about it, if we can keep people longer in place at home, if folks have to transition into independent living, well, hopefully the Seni products come with them and they age longer there, which is great for everybody, that they're more, the loved ones say, okay, well, now we're in independent living, but I have more time with you here. And then if they go into ALF or the gamut into skilled, at least we're overall on the same team, hopefully across the country, thinking what's best for dignity, less social isolation, better outcomes for everybody. And if we can do that, to me, that's what it should be all about, in my opinion.
Well, you talk about dignity, and I'm just thinking of staff, because the CNAs and the aides in home care, I mean, they don't have the best jobs in the world. And, that was kind of lifted out. I mean, we need them. I mean, more than anything out there, and yet they're not really well-respected jobs. So if we can bring dignity, not only to the patient that you're serving, but also to the staff, because nobody really wants to have to go in and change somebody multiple times, or be stripping the bed, or being fearful someone's going to fall. I mean, all that stuff's really heavy stuff. And then it takes away from the engagement aspect, in terms of things. And so if they, it's great, everybody wants to stay home, or 90% of the people do, that's where they prefer to live. But if they transfer into other settings, these will help those positions as well, in those communities. I mean, they're all getting, quality control checks on, is there a urine smell? How many falls are you having? All of those things are ticking away. And it really conserves, in my opinion, from what I've heard from everybody, conserves staff's time to be able to do more fun things that people want to do that bring quality of life. So Jill, this gets me to my next question, because, people, I think when they're dealing with incontinence, they feel isolated. They're nervous about going out. What if I have an accident? They want to go to a wedding, but oh gosh, that might be a little bit too long. I mean, all of those types of things come into play. And do you see that in what your staff are able to do, a change in their openness to maybe feel freer, to be able to be themselves and do more with the Seni product?
Definitely. Our main goal, if the person wants to come home and say they're rehabbing from an injury, they're wanting to have that PT come every day. They're wanting to get up. They're wanting to get back into their community to regain their normal life. There are still setbacks to their limitations to what they can and can't do yet, because they're still healing, they're still rehabbing. So part of that comfort level, and I think we've all addressed it, is the quietness, the leak-proof measures that have been taken by Seni and the Seni products, to know that they can confidently regain their PT, their mobility by working with their exercise, their therapy on different positions of rehabbing different parts of their body. And they can concentrate on what they have to do with PT and not worry that if they're going to bend my leg too far, if I have to do a squat or chair lifts or step ups, am I going to, leak? Am I going to have a little issue? If they're wearing these products, they know that, and they're starting to trust it because now they see a difference from what maybe they had before. And now what I've brought into the house, and they're really experiencing it hands-on, their comfort level and their confidence level, not only in their abilities to ambulate and move around and get back into their friends and doing their things that they enjoyed before their injury, but they're also able to realize they can do it confidently without rushing their body to heal and safely, because no one is discreet. No one, you don't hear that swishing, you don't hear that crinkling, and they're not worried like, oh, if they open my leg or rotate my hip, is something going to happen or leak? So, it's a part of aging, and it's a part of healing, and we have to just, as a community of caregivers, that's compassion. We have to have these educated discussions openly without making them feel embarrassed, and that's part of where training and compassion, but also knowledge of the product is such an easy talking point for me now. They see I'm not embarrassed. I'm not talking with any shamefulness. It's how can I help you? How can I help you recover? And this is part of your recovery. Like it or not, it's okay. This is what we're going to do with you to get you better. So once we can talk about it in that type of tone and that from that educational standpoint, it really makes the patient and client feel a lot better.
Yeah. And they don't feel talked down to,
Not at
and
all.
they don't feel like it's a decline. It's part of living and part of life. And a lot of people do it. So again, these comfortable conversations, I think, are so important. And Seni, the way you're going about training people to be able to go in and pass that along. And it's not a taboo topic for you guys. I mentioned this in one of the other shows when I first met Deanna. I had never seen anyone excited to talk about incontinence product. And it was like, okay, I think I got to get a seatbelt and buckle her down because she's just ready to burst, because this woman is going to change the world. And you guys really have, in terms of making it simple, making it dignified, being there ahead of the game, just making the process simple for the client and the organization that you're working with. I mean, it just is such a huge, huge difference. And I think it's really important. Jill, you also mentioned, which I think is key, you said, and they trust the product. That just sums it up right there. Because I think everyone's kind of like, well, it worked okay one time, but not another time. But when you feel comfortable to really, I'm going to be okay, your persona is different, your engagement level's different.
It really
You're willing to stay a little longer. You get your personality back. And I think sometimes people don't understand how much of that is lost through that isolation, through feeling so vulnerable and unsure of what to do. And then for families, being able to take somebody out more often, or not having to walk into the house and smell urine.
Exactly.
And even sometimes the client can't smell it, but others can. Or we've talked about, the chair is wet, and there's so many different levels of dignity and comfort that just ripple through everybody. A mood change just for staff coming in going, you know what, we're probably not going to have an accident this morning. So we can just really get to what we need to get to. And both our moods are going to be better. It just makes so much sense. Jill, is there anything that I didn't ask you that I should have, that you think it's important for people to know about Seni?
Well, I think we talked about a lot of the incontinence products, but I think it goes back to really the barrier creams as well, and the wash, keeping the skin healthy. People just think, oh, it's because I can't make it to the bathroom. Well, that's okay. We understand. We're happy to help. But it goes a little bit further than that. It goes back to the hygiene, keeping the skin hydrated, keeping the skin moist, and barrier-free cream really helps. It doesn't have an unpleasant odor. It's not like a medicine smell. It's a very pleasant cream. It goes on clear. It's very light, but it actually is really effective. And once they start to understand the whole system of keeping themselves well, not just maybe the part that's injured or the rehab that has to go back to making that part better, it's their whole body, because preventing infection any place in your body is going to prevent you from getting back to a medical environment, whether it be a hospital or another rehab stint. But once you can have that conversation and they understand, oh, okay, 1 and 2 go together, that helps their overall well-being. And it's for us to keep it as an agency to offer this whole type of package to them. My caregivers are able to do that much of a better job all the time because those supplies will be there. And it's very easy. Either, like I said, the families can order it, or I have clients that just call and say, can you just please order it? Just put it on my bill and I work it out. We work out the details. We make sure they get what they need and it gets delivered personally or shipped. But we're happy to do what we have to do in order to get them the quality products that they need.
Yeah. And that's, again, another relief barrier for families of things that they don't have to do if they can just, just tack that onto the bill. Because it can get overlooked, it can get missed, care partners are busy, issues happen in their life. And then all of a sudden, oh my gosh, now we're without, now we got big trouble. And the last thing they want is their loved one having a UTI because they didn't get the supplies on time and had to use something else. Laurie, anything that you wanted to add in terms of isolation, or just maybe a topic that we hadn't covered that we should have?
Yeah, so I was going to say, the really nice thing too is by taking the work off those family members is that, some of these people are, they don't have as much time as they would like to visit with their loved ones. And so if we're talking about a 2-hour span that a daughter or son, is going to visit their mom or dad, they don't want to take up half of that time running to CVS, running to the big box stores, maybe even that big box store not having their size or not having what they usually wear. And now they're really at a loss. So by having everything in place, the caregivers are, reducing that risk of shoulder injuries and things like that, because they're not changing those sheets every single morning. So I think, when you pull all of it together, it just, it's everyone's happy. The resident is very happy. The families are very happy. And also the home care agencies, they play such a pivotal role. So if one of their clients does unfortunately, have to go to the hospital for whatever reason, the nice thing about being enrolled in a program like this is when that person is asked when they leave that hospital, have you ever used a home care agency in the past? Well, guess who comes top of mind? Instead of that hospital pushing maybe, the company they usually use, now, that person, if they're using Platinum, they're absolutely going to say Platinum because they already have a Continence Care Program in place with Platinum. So it's just going to be top of mind for them. So I think that's really nice too for the home care agencies to be a part of that.
Wonderful. Deanna, how about you? Anything you want to add on the isolation piece or anything else that we've missed so far?
I'll just add on the isolation piece. It's with the pandemic, under the bright light came the topic of social isolation. But for my teammates and I at Seni, that bright light had always been shining pre-pandemic for people that have incontinence, whether they're afraid to leave their house, their apartment, makes no difference because of that fear. So in a positive light, if we look for silver linings of the pandemic, for people to realize the negative implications of social isolation, can make conversations like this even more comfortable about that. But I would just encourage folks out there, for people that are living with people that are incontinent, there's a difference between, you can be not alone, but lonely. You could be in a big room with 50 people and still feel very lonely or socially isolated because you have worried of, now I'm in a room with 50. So, your family members, your friends could all walk away and say, gee, grandma had such a great day today. She was with everything. And I just encourage people, make sure grandma had a really good day, and having those conversations or being aware, because unfortunately for a lot of people, social isolation has many different avenues, and it will continue, unfortunately, post-pandemic. However, I'm so grateful for people like Jill and the other home care agencies and the communities and distributors, and I can go on and on. I'm just very grateful that I think we are at a point in time where there's more awareness of the overall well-being is crucial and grows legs into physical, emotional, spiritual, all different avenues. And I think that's really kind of cool how we're a small component of that. So just grateful for your platform, Laurie. I could go on and on, but yeah, with social isolation, if we can reduce it, if we can have more happy people and less worry, that's a good thing for everybody, right?
Exactly. Well, ladies, thank you so much for your time today. Again, I learned something new. This is our third session, but every session I hear different pieces and the importance of the Seni Continence Care Program. It just is so valuable, and I hope more people do check this out. As far as contact information, you can reach out to Deanna at her email, and it's Deanna dot, and I'll spell her last name, Vigliotta at TZMOUSA.com. And TZMO is their kind of mothership, their parent company there. The website you can go to is Seni, SENI-USA.com. And you can go to TZMO-global.com as well, or feel free to reach out at 850-503-7534. And we have other contact information like LinkedIn and Facebook and YouTube you can check too. And then for Platinum Care, you can go to Platinum and then HCNJ for New Jersey.com. And their Facebook page is Platinum NJ. And their Instagram account is Platinum Home Care LLC. And again, this contact information is on the show page as well. So thank you all so much for being with us today. I really appreciate your time. We are going to go out hearing from the All's authors. So until next time, have a blessed week, everybody. Bye now.
Hello, podcast listener. If you're caring for a loved one with Alzheimer's or dementia, you'll want to check out All's Authors, the global community of authors writing about Alzheimer's and dementia from personal experience. We have the most comprehensive collection of hundreds of carefully vetted books and blogs covering all types of dementia and caring situations. Our authors' personal stories and painfully learned lessons can help you on your own journey. We also offer a fabulous podcast called Untangling Alzheimer's and Dementia, which you can find on any of your podcast platforms. Remember, you are not alone. One can sing a lonely song, but we chose to form a choir and create harmony. Find us at allsauthors.com.